So good day ma'am, my name is Dario A. Marcel Jr. and today I'll be performing a return demonstration of administration of metered dose inhaler or MDI. So a metered dose inhaler or MDI is a small portable aerosol dispensing device. These devices are hand operated and powered by an HFA propellant much like an aerosol spray can. So each activation of trigger dispense known dose of medication. The patient squeezes the MDI trigger during deep inhalation, depositing the aerosol into the respiratory tract. Then these devices are convenient to use with proper technique, can be effective. Then this is our equipment, assuming this is the metered dose inhaler and the spacer. Then first is verify the physician's order, then review the patient's chart, then assuming we already identify and review the patient's chart. And again, since we don't have a real patient, so I'll be do it all by myself. Then gathered all required equipment, then check it to ensure that all medications are available and expiration dates are current. So okay pa siya, hindi pa siya expired. Then provide privacy and hand washing. So the importance of this hand washing, as we all know, is to deters the spread of microorganism. Then identify patient, then introduce self-explain and explain the procedure. An explanation of the procedure relieves the patient's anxiety about the procedure. So, hi ma'am, may buntag. Ako din si Dario A. Marcel Jr. Karong adlaw ako yung RT intern. Then karong adlaw ma'am tuluan ti ka unsaon paggamit aning inhaler. Then para ni sa mga patient na asthma and sa mga patient na nagalisod og hinga. So tuluan din ka sa technique ma'am, then relax lang and participate lang, mawaliw ko mag-participate lang tarong ma'am para ma-perfect na to ang buhaton karon. Then that's it. Then place the patient into a comfortable sitting position or into a semi-fowler position for lung expansion. Then assess the patient, then auscultate the chest and measure the heart rate and respiratory rate, then measure the peak expiration flow for indicated to obtain baseline data to note any abnormal breath sounds or other findings. So since this is an imaginary patient, then assuming we'll already auscultate, then after that no other problem, then shake thoroughly and prime the MDI before use. So i-shake nato siya before use. Then example ato silang i-shake sa. Then because it is done to mix the drug and the propellant, which can separate the canister over the time. Then priming is required to provide an inadequate dose according to the manufacturer's guidelines. So kailangan dyan nato siya i-shake. Then after that attach the mouthpiece to the canister and remove that cap from the mouthpiece. Then if a spacer is used, attach the spacer device to the MDI. Ensure that the aerosol can pass through the spacer without obstruction. So because the spacer device help to slow the velocity of aerosol particles, enhance the vaporization of the propellant, and reduce the amount of coordination required to obtain optimal result. So for example, this is our MDI. Tuwa na siyang muna ang spacer datos ato ni siyang i-out dari. Tapos iguot lang siya. Then after that have the patient hold MDIs a few centimeters from open mouth. Then instruct patient to inhale slowly, deeply, while activating the MDI by squeezing it. So, for example, I'm the patient. So, ma'am, ang kani ma'am muna to ang unsa ni MDI na muna tong gamiton karon. Ang paggamit na ni ma'am inganion. So, mo dire ibutang ang imong baba dapat naka-save jud siya. Tapos pag maghinga ka ma'am, ingani pislito i-squeeze nimo ni siya. Tapos paghinga nimo mag-hold ka og 10 seconds bago ka mo ginhawa. Okay ba na si ma'am? Sige. Then instruct the patient to continue to inhale and hold the breath for at least end of 8 to 10 seconds. Then allow the proper deposition of medication to the smaller airway. So na isra ka na to si ma'am. So after that, have the patient slowly exhale following the medication administration. Then repeat the procedure as many times as ordered by the patient's physician. Then waiting between puffs. So since ang gihatag siya sa patient nato kay duha lang ka buok, duha ka puffs, so after 10 seconds gamit na po siya og MDI para iyan na pong inhale. So okay lang ka ma'am? Tingog-tingog po ma'am. Okay na rin ka. Then after that, reassess the patient, then monitor the patient's heart and respiratory rates following medication administration. Then auscultate the chest, measure the peak expiratory flow following aerosol administration. This is to note any changes in breathing sound or to evaluate effectiveness of therapy. So since positive all, nag-response ang tanan namong gipang test ni ma'am. Kay grabe ka participative ni ma'am. So after that, then give health teachings regarding the medication. For corticosteroids, instruct to rinse mouth after every puff because prevent the oral candidiasis. Then do after care all the for the equipment. Then wash hands to deter the spread of microorganisms. Then document the time of therapy, then medication use and patient response therapy. Then because note the tolerance of the treatment, then a written summary provides an accurate documentation of the care and response of the patient to treatment. Then that's it. Thank you ma'am. Salamat kayo ma'am and ayo-ayos yung mga paglakaw.